Hello, I'm Catherine, a lactation consultant from the Breastfeeding Centre at King Edward. Today we're going to look at use of a nipple shield, and I'm going to welcome shortly Sarah and baby Emma to be involved in that demonstration. Correct positioning and attachment are the foundation of good breastfeeding. However, every now and then the mother-baby fit isn't quite right, and we need to introduce a lactation aid or a nipple shield to help a woman achieve her goals and to effect good milk transfer, stimulate a good supply, and certainly to be able to perform effective breastfeeds. Nipple shields are certainly not band-aids for sore nipples, and if a woman does have sore nipples, we need to certainly find out the cause of the problem, heal those nipples, and then evaluate, does this mother and baby dyad need to use a nipple shield to effect good breast attachment at the breast. Nipple shields should never be introduced until secretory activation has occurred, and or a baby, the milk's come in. A baby can spend a long time at the breast sucking and ineffectively transferring milk, and that is not the scenario you're looking for. Good follow-up is really important when you've introduced a nipple shield, and also we encourage our women to be doing some expressing and giving their babies some express breast milk until we know that that baby is doing a really good job at the breast with a nipple shield. When sizing a nipple shield, we're definitely looking at the shape and size of a mother's nipple, and the size of the baby's mouth. So they can be quite variable, and there is an assortment of sizes and shapes of nipple shields available for use. So it's really important that a consultation occurs and that we really have a look at what's going on for this mother and baby fit and the use of a nipple shield. Hello Sarah, thank you very much for joining us today in the Breastfeeding Centre to have a look at use of a nipple shield. The nipple shield can be warmed by running it under warm water. It makes it more pliable. You can also apply some of your express milk to the areola portion of the nipple shield and into the teat of the nipple shield. Makes it attractive for the baby to vacuum onto that shield. When we are applying a nipple shield, we would often fold it back on itself, and then as you peel it onto the nipple, it will draw the nipple into the teat part of the nipple shield, and then your baby doesn't have to work as hard to start breastfeeding. Okay, you might like to have a go at that.
Okay. Hello.
That's a girl. And that cutaway portion of the nipple shield goes where your baby's going to have her nose. That's a girl. That should vacuum your nipple into the shield. All right. Your normal position for cradle applies. That's a girl. And then what we would do, and sometimes it takes several attempts, what we would do is just touch the baby with the tip of the nipple shield underneath the nose or the philtrum. Using your hand to stabilise the shield is often effective, yeah. We often wait. That's it, have several attempts, and then just touch her underneath her nose, wait for the big wide mouth, and a big mouth, good girl, and then sometimes you can just place the shield on the breast, and then you're stabilising that shield well, Sarah. Yeah, sometimes they will object a little bit until they get a lovely letdown. You can help that letdown by just moving the milk down your breast. Some gentle compressions, some gentle stroking. Just bring her across to me a little bit more, my love. That's a girl. There we go. Now, when a baby's on, the sucking should be nice and rhythmically. We should have maintained lovely shoulder girdle support, and you should be listening for swallows for your baby. We shouldn't hear any noise, and we shouldn't have any bouncing on that nipple shield. That's it. Every now and then they flip up, so you just need to peel it back there to your breast. That's a girl. That's it. Now use some stroking, gentle stroking or piano movement on your breast to move the milk. That encourages letdown, helps your baby stimulate sucking and swallowing, and helps to empty the breast.
I know, it's coming. It's coming. There you go.
It's really important that you continue to do a little bit of pumping, Sarah. If your breast is full and lumpy after a feed, we'd encourage you to express so that your breast was soft and comfortable with no lumps. And then depending on your lactation consultant or midwife, they may have you doing several expressions during the day to offer your baby a top-up with the express milk. Also available on the King Edward website are some DVDs that will talk about expressing, giving your baby a finger feed, and they're available to you. And if you want general breastfeeding information, you can use the pregnancy, birth and your baby booklet that you will have access to either online or a hard copy. There shouldn't be pain or discomfort at any time. Is that comfortable?
It is, yes.
When it comes time to wean the shield, Sarah, we would generally start the breastfeed with the nipple shield because that's what she's imprinted with, what she's used to. That's her method of feeding. So you would take the edge off her hunger and then you'd bring her away from the breast like you just did, remove the shield quickly and pop it here, love. And then I want you to just shape your nipple up, one finger there at 1 o'clock, just tilt underneath her nose and fold a big amount into her mouth. Perfect. And she may fuss a bit when you first start doing it, but if you consistently start doing it every day for a couple of the feeds, she'll soon realise that this is a method of getting milk. Mum starts with my shield and then moves me to direct breast, and you'll find that then that transition occurs over a few weeks. Often when we're weaning from a nipple shield, we need to wait till our babies are 8, 10, 12 weeks. We're waiting for that baby to grow orofacially and develop the skills to create the good vacuum. Do you have any questions at all?
No, that's fine.
Okay.
Thank you.
Thank you very much, Sarah and baby Emma, for joining us today for the demonstration of how to use a nipple shield.